Image copyright Getty Images Image caption WannaCry was the biggest cyber attack that has affected the NHS to date. NHS trusts were left vulnerable in a major ransomware attack in May because cybersecurity recommendations were not followed, a government report has said. More than a third of trusts in England were disrupted by the WannaCry ransomware, according to the National Audit Office. Now, at least 6,900 NHS appointments were cancelled as a result of the attack. NHS England said no patient data had been compromised or stolen and praised the staff response. The Now chief said the Department of Health and the NHS must now get their act together. WannaCry, which spread to more than 150 countries in a worldwide ransomware outbreak beginning on the 12th of May, was the biggest cyber attack to have hit the NHS to date. The malware encrypted data on infected computers and demanded a ransom roughly equivalent to £230, $300. The Now report said there was no evidence that any NHS organization paid the ransom, but the financial cost of the incident remained unknown. An assessment of 88 out of 236 trusts by NHS Digital before the attack found that none passed the required cybersecurity standards. Image copyright Getty Images Image caption As a result of disruption caused by WannaCry, patients were turned away from appointments. The report said NHS trusts had not acted on critical alerts from NHS Digital and a warning from the Department of Health and the Cabinet Office in 2014 to patch or migrate away from vulnerable older software. The Department of Health also lacked important information, the report said. Before the 12th of May 2017, the department had no formal mechanism for assessing whether NHS organizations had complied with its advice and guidance. Organizations could also have better managed their computers' firewalls, but in many cases they did not, it said. NHS organizations have not reported any cases of harm to patients or of their data being stolen as a result of WannaCry. NHS England has identified 6,912 appointments, including operations, that were cancelled as a direct result of the ransomware. But it estimated that about 19,000 appointments in total may have been affected. Media playback is unsupported on your device. Media caption technology explained. What is ransomware? Cases included at least 139 people potentially with cancer, who had urgent referrals cancelled. It is not known how many GP appointments were cancelled, how many ambulances and individuals were diverted from 5 accident and emergency departments unable to treat some patients, how many trusts or GPs experienced delays in information, such as test results. The Now credits the widely reported work of cybersecurity researcher Marcus Hutchins, who accidentally helped to stop the spread of WannaCry. His kill switch involved registering a domain name linked to the malware, which deactivated the program's ability to spread automatically. Media playback is unsupported on your device. Media caption Listen, how malware tech became an accidental hero. Home Office Minister Ben Wallace told BBC Radio 4's Today programme that the government was, as sure as possible, that North Korea was behind the attack. This attack, we believe quite strongly that it came from a foreign state, he said. It is widely believed in the community and across a number of countries that North Korea took on this role. Speaking on the same programme, former chairman of NHS Digital, Kingsley Manning, said that a failure to upgrade old computer systems at a local level within the NHS had contributed to the rapid spread of the malware. He said, the problem with cybersecurity for the NHS is that it has a particular vulnerability. It's very interconnected, so if you get an attack in one place it tends to spread. Mr. Manning blamed a lack of time and resources, but also, frankly, a lack of focus, a lack of taking it seriously, for individual NHS organizations' failure to keep up with cybersecurity improvements. This was an extremely unsophisticated attack, he added. The Now said the NHS has accepted that there are lessons to learn from WannaCry and will now develop a response plan. It'll also ensure that critical cybersecurity updates, such as applying software patches, are carried out by IT staff, the Now said. WannaCry was a relatively unsophisticated attack and could have been prevented by the NHS following basic IT security best practice, said Sir Amias Morse, Controller and Auditor General of the Now. There are more sophisticated cyber threats out there than WannaCry, so the department and the NHS need to get their act together to ensure the NHS is better protected against future attacks. Keith McNeil, NHS Chief Clinical Information Officer for Health and Care, said, as the Now report makes clear, no harm was caused to patients and there were no incidents of patient data being compromised or stolen. Tried and tested emergency plans were activated quickly and our hardworking NHS staff went the extra mile to provide patient care, keeping the impact on NHS services and patients to a minimum. Analysis by Rory Selin-Jones, technology correspondent for many executives. A serious cyber attack is now very high on their list of risks to their organizations and a priority for disaster planning. So what is most